UK Healthcare Community Connection is sponsored by UK Healthcare.
Welcome back. Dr. Katie Roberts and Dr. KOLT PRUITT from UK Healthcare Sports Medicine are here to talk about fast, convenient access to orthopedic care.
From walk-in clinics to caring for local athletes, they're helping keep our community moving. It's nice to have you here. If you would, start off for us, please, by telling us about the roles you have at UK Healthcare's Turfland Sports Medicine Clinic.
Yes, so we both work as sports medicine physicians, so our goal is to evaluate injuries, orthopedic injuries, diagnose them, and then come up with a plan to treat them and get people back to being as active as they can, as quick as we can.
What about your clinic makes it so unique?
I think the big thing that we're able to provide at UK Turfland, especially through the walk-in clinics, is that you're getting access to specialty trained physicians. So we did fellowship programs in this, which allows us to assess these injuries and follow them through even after walk-in clinic hours. And so you're coming in and that day seeing a specialty trained physician.
They also offer a general orthopedic walk-in clinic. How does that help patients?
So it typically helps patients by if they have an acute injury, whether that be getting injured doing something active, getting injured mowing the lawn, getting injured while out shopping. It allows them a place that they can come in that's not the emergency room to get imaging done and be evaluated same day.
In addition to the clinic, you're both team physicians. What is that all about?
Yeah, so we're both really proud to be team physicians for EKU Athletic Department as well as Lexington Sporting Club. So we serve those athletes in a lot of different roles. That can be on the sideline, managing an acute injury during a game, but a lot of it's also seeing them in the training room, in the locker room, and treating even chronic things that kind of last longer through the season.
Why is quick access so important for individuals who need the assistance?
So typically patients, if they're dealing with these issues for a long time, whether it be weeks or months, and a lot of times it can take that long to get in to see a specialty provider, those things can be getting worse, and then it can take longer for them to get better. So ideally, the sooner we can get patients into clinic, the quicker we can get them better and back to doing what they want to be doing.
So the walk-in clinic, where is that? Like, where is it? How does that work? I mean, obviously you walk in, but walk us through, nonetheless, what an appointment would look like versus, let's say, if you made an appointment a few days after.
So you would come to the UK Healthcare Turfland location, 2195 Harrodsburg Road. You would show up at the front desk, let them know what you had going on. From there, you would be seen and probably x-rayed before you even got back to see one of us. And then within an hour, hour and a half, you're seen by a physician and taken care of and on your way, hopefully with a good treatment plan.
Now, if you were to make an appointment, how long does that take? Because you just said you can get treatment within an hour with the walk-in clinic.
We try to get people in pretty quickly into our clinics, but it does require typically a referral from another physician, and so it could be a couple of weeks before you could be seen. So if it is something that just happened recently, totally appropriate to be seen in the walk-in clinic.
What an amazing resource.
Yeah, last thing, how gratifying is it to help these people get back on their feet, especially you have a lot of athletes who you say you're dealing with. They want to get back to the competition. They don't want to be out very long.
Yeah, it's very gratifying. I know that, activity is something that keeps a lot of people going mentally, but also obviously physically. So I think, being able to diagnose quickly and come up with an efficient plan to get these, athletes and, weekend warriors back to doing what they want to do as quick as we can. I think that helps their total health, not just their orthopedic health.
Mental health probably after
Mental
that is what
health,
you're
yes.
mentioning. Yes. All right, here's some information on your screen. Dr. Roberts, Dr. Pruitt, thank you so much for being here this morning.
Thank you.
All right, we're back with more right after this, so don't go far.
You're watching Fox 56 News, our home, your news.